Hi, my name is Linda Okafor, and in this week 9 journal, I had an experience with a patient that significantly impacted my understanding of psychiatric mental health nurse practitioner role, psychopathology, and the provider patient relationship. This case involved a middle aged woman who presented with symptoms that were initially suggestive of major depressive disorder, but ultimately turned out to be bipolar disorder. This diagnosis was a revelation for both the patient and my preceptor. The patient, a 45-year-old woman named Tina, had a history of depressive episodes. She reported persistent sadness, loss of interest in activities, fatigue, and difficulty concentrating over the past 6 months. Her medical history indicated several similar episodes over the past decade, each lasting a few months and resolving with antidepressant treatment. However, during our section, she also disclosed periods of elevated mood, increased energy, and decreased need for sleep that she had previously dismissed as just feeling better. This case underscored the complexity and nuances of the psychiatric mental health nurse practitioner role. It highlighted the importance of thorough and comprehensive assessment to uncover details that might not be immediately evident. I learned the critical role of exploring the patient's complete psychiatric history and the need to ask specific questions about mood variability, which can be easily overlooked if the focus remains solely on depressive symptoms. The diagnosis of bipolar disorder rather than major depressive disorder brought to light the intricate nature of psychopathology. It reinforced the importance of differential diagnosis in psychiatry, where overlapping symptoms can mask the underlying condition. Recognizing the hypomanic episode was crucial, as the treatment approach for bipolar disorder significantly differ from that of major depressive disorder. This case taught me the significance of mood stabilizers in managing bipolar disorder and the risk associated with treating such patients with antidepressants alone, which can potentially trigger manic episodes. The interaction reinforced the value of building a strong therapeutic alliance. Patient was initially hesitant to suggest her period of elevated mood due to fear of judgment or misunderstanding. The approach, which involved active listening, empathy, and creating non-judgmental space, encouraged her to open up about these critical aspects of her history. This experience highlighted my strength in establishing rapport and trust with patients, which is essential for accurate diagnosis and effective treatment planning. One of my strengths is my ability to listen attentively and provide a supportive environment, which helped the patient feel comfortable discussing her experiences. However, I realized a limitation in my initial assessment skill, particularly in not delving deeply enough into the possibility of bipolar symptoms. This gap highlighted the need for ongoing learning and vigilance in considering a wide range of differential diagnoses. Reflecting on this case, I recognize the importance of my presence and demeanor in facilitating open communication. My calm, empathetic approach helped mitigate the patient's anxiety about her symptoms and encouraged her to share more freely. This therapeutic use of self was crucial in uncovering a full scope of her condition. From this interaction, I learned the necessity of comprehensive and meticulous assessment in psychiatric practice. Moving forward, I will incorporate more detailed questions about mood variability and energy level into my evaluations to ensure a thorough understanding of each patient's condition. Additionally, this case reinforced the importance of continuous education on various psychiatric disorders to enhance diagnostic accuracy and treatment efficacy. In conclusion, this experience significantly enhanced my understanding of the psychiatric mental health nurse practitioner role, psychopathology, and the provider-patient relationship. It emphasized the need for thorough assessment, the importance of a strong therapeutic alliance, and the value of continuous learning. I will apply this insight to improve my practice and provide better care for my future patients. Thank you very much.